Hello and welcome to Arogya Physio Tips. I'm Dr. Zahur Mir, and today we are going to discuss about the hip bursitis, or it's also called as a trochanteric bursitis. Here we have the model of hip. You can see this is your thigh bone, and this is actually the pelvis. One side will be here, the hip bone, so it will become the complete pelvis. So what happens here? This bony prominence which is coming out, it's called as greater trochanter. And if there is an inflammatory condition over this area, that's called as trochanteric bursitis. Over this bone, we have one bursa, that's one fluid sac, and when there is inflammation in that, that causes the trochanteric bursitis, or what we call as lateral hip bursitis. And this bursitis, it's very painful, and it makes a person uneasy to walk, to sit, to stand, to sit for a long period of time, for IT professionals or even those who are sitting on a chair for a long period of time. So why this happens? This trochanteric bursitis, it happens because of many reasons. The first reason is if a person falls on the side. For example, if a person falls like this, so there will be injury in this area. This prominent bony area, it's called as greater trochanter. When person falls like this, there is trauma to this area, and it can cause pain in this area, and what we call as the trochanteric bursitis. Apart from this, some person has a habit of leaning one side like this. Okay, so by this what happens? When you are leaning like this, the muscle over here, what we call as the IT band, iliotibial band, what happens? It puts the pressure over the greater trochanter, and the bursa down, it's inflamed. Apart from this, other reasons includes if there is a tightness in the IT band, that can also cause friction between the bone and the bursa, and the bursa can get inflamed, and we have pain. Front side, we have one muscle called as the iliopsoas muscle, and here is also one bursa. If this muscle is tight, it can also lead to bursitis or pain. Similarly, if there is a glutes muscles, what we call as the buttock muscles, if buttock muscles are tight, they can also cause bursitis, and the pain will be in this area. And this, like if you will see, like while walking, these structures are moving, or while standing, these muscles, they are helping us to stand or walk or to sit. But when there is a bursitis, so the pain will be while walking, while going upstairs, while standing for a long period of time, while sitting over the chair. Before planning the treatment physiotherapy exercises for the hip bursitis, we must know what is the cause of the bursitis. Because if you go through the YouTube videos and all, you will see that do the stretching, do the strengthening. But stretching, sometimes it may elevate the pain, it may aggregate the pain, or strengthening, it may aggravate the pain. So that is the reason. It depends upon the cause. It depends upon the cause which is causing the bursitis, hip bursitis. So first of all, we need to diagnose the cause of the bursitis. And now let's talk about the stretches and strengthening exercise for the hip bursitis. So first we will do the stretching of the IT band. So for stretching of IT band, what we will do, we will take some belt or band like this. Then we will lie down with the back. Then take your leg up till you are feeling the hamstring stretch, and thereafter what you will do, you will push it inwards. While you are pushing it inwards, you will feel the stretch in this area, what we call as the IT band, and hold the stretch for 20 to 30 seconds and repeat it 3 to 4 times, and it depends upon the tolerance of the patient. But make sure what the patient will do, they will tilt like this. Your hip should not come up from the ground, okay? It should be attach the ground and then do this, then you feel the stretch. So if the bursitis is because of the anterior bursa which are present on the front side of the hip, so what happens, the limb which is affected, you will keep it little backwards and move little forwards. Then what you are supposed to do, keep your back straight and shrug your buttock muscles, then shift your body forwards, and you will have a nice stretch over the anterior, over the front of the thigh, and hold it for 20 to 30 seconds and repeat it for 3 to 4 times, and it depends upon the tolerance of the patient. So as you know that in the trochanter, what happens, there is insertion, there is attachment of the glutes muscles. So these gluteus muscles, they are actually the group of muscles: gluteus maximus, gluteus medius, gluteus minimus, and there is also the piriformis muscle, which is a deep muscle. And these muscles are attached to the greater trochanter, which can lead to the trochanteric bursitis. For this, if there is tightness in these muscles, what we will do? We will stretch the gluteus muscles. For stretching the gluteus muscles, what we will do? We will have the figure of 4. The figure of 4 is like this. And for example, my left leg is affected and I want to stretch over my left gluteus. What I will do? I will bend the left leg like this, and then I will take it towards me. Okay? So like this is the figure of 4. Then I will push my body forward, but make sure that your body is straight. Okay? When you are moving it forwards, you will have a great stretch in your back. You have the great stretch in your gluteus muscles, and hold it for 20 to 30 seconds and have the repetitions of 3 to 4 depending upon the tolerance of the patient. So for the strengthening of the IT band, what I will do, first of all, I will lie down on my side like this, and my body should be straight. Okay? When the body is straight, then thereafter we have to bend both the knee, and these ankles should be facing towards each other. And then have one pillow support, or you can place your hand here, and then thereafter I can do like this. But make sure you are not doing too much that you are tilting your pelvis. Don't tilt your pelvis, do it as much as possible. And this is for the beginners. But if you have the enough strength, then what you will do in the same position, then bend this for the greater base of support. Then you can take your leg straight up. Okay? And hold it for 20 to 30 seconds. And you will repeat it for 3 to 4 times. Again, it depends upon the tolerance of the patient. Another exercise, we should go for the side planks. So for side planks, what we will do, we will lie down like this. But for the initially, for example, if there is too much of pain, so at that time what we will do, we will place the one foot over here, the lower foot, it should be straight like this. It will come like this, it's next to my shoulder, my elbow, and my other hand, it's like this. Then I will have the hip dips. When you have already developed the strength, so you can modify the side planks. How you modify? Lie down in the side, and your shoulder, it should be directly, your elbow should be directly down the shoulder, and now straight both the legs, and you can place your hand here also, and then for the strengthening of the quadriceps muscles, or the front group of muscles of the thigh, what we will do, we will sit down with the high sitting like the chair, and we'll apply some weight cup, and then thereafter, where suppose our fingers, our toes, it should be pointed towards us, then lift it up, bend, straight, bend, and you have to do it for 20 to 30 seconds, 20 to 30 repetitions, depending upon the strength of the patient. If you are located in Bangalore, then do visit our clinic, and we are located in the Medex Hospital, Gotigiri, or the Bannerghatta Main Road, and we have one more clinic in the Jigini. Do like, share, and subscribe our YouTube channel, and witness your fitness with us. Thank you very much.